Okay, welcome back everyone for another deep dive. Today we're going to be talking about something that's pretty important, especially for,
Yeah.
people of, a certain age,
Yeah.
something we should all know more about.
Absolutely.
And that is sexually transmitted infections,
Ooh.
STIs or STDs.
Right.
So we've got a ton of information from the CDC, and we're going to be diving into the most common types, symptoms, risk factors, all that.
Okay.
The complications, the things you don't want to think about,
Yeah.
and really how to protect yourself and others.
Yes, very important.
So let's just get right into it.
Let's do it.
So first off, when we say STIs or STDs,
Right.
what are we actually talking about here?
That's a great question. So STI stands for sexually transmitted infections.
Okay.
And that really broadly covers anything that can be passed through sexual contact.
So it's an infection.
Yeah.
It doesn't necessarily mean you
No,
have a disease.
That's the distinction.
Got it.
So STD, sexually transmitted disease, is only when that infection actually causes you problems, causes you symptoms.
Interesting.
Yeah.
So you could have an STI
Yes.
and not even know it.
Absolutely. That happens a lot, actually. A lot of STIs,
Really?
or what we call asymptomatic, meaning no symptoms.
Wow.
So you could have it, spread it, not even know.
So basically everyone should get tested?
Regularly.
Yeah.
Yes, absolutely. It's so important for your own health and for the health of your partners.
Got it. So let's talk about the different types of STIs. Our sources talk about three main categories:
Okay.
bacterial,
Yes,
viral, and parasitic.
that's right.
So is it bacterial?
So these are caused by bacteria.
Okay.
And the good news is that they're often curable with antibiotics.
Okay, so like what would be some examples?
So some of the common ones you might heard of:
Yeah.
chlamydia,
Okay.
gonorrhea, syphilis.
Right.
These are all bacterial STIs.
And those are all treatable with antibiotics?
Yes, if caught early enough. It's really important to get tested
Yeah.
and treated as soon as possible.
Okay. And then viral?
So viral, a little bit different. These are caused by viruses.
Right.
And we can't necessarily cure them the same way we can with bacterial infections,
Okay.
but we can manage them with antiviral medications.
So what are some of the common viral STIs?
So some of the ones you've probably heard of are HIV,
Right.
HPV,
Okay.
herpes,
Mm-hmm.
and hepatitis B and C.
Okay, so there are ways to live with these.
Yeah, there are ways to manage
Right.
them and live healthy lives with these infections.
And then the last category, parasitic.
So this one's a little less common, but still important to know about.
Like what's an example of a parasitic STI?
So the most common one is trichomoniasis.
Trichomoniasis.
Yes.
What even is that?
It's a mouthful, isn't it? It's caused by a tiny parasite.
Really?
Yeah, it's a single-celled protozoan parasite.
Oh, wow.
Yeah.
Okay, so let's say somebody thinks they have an STI. What happens if they just ignore it?
Oh, that's a bad idea. It's really important not to ignore any potential symptoms,
Okay.
because untreated STIs can lead to some serious health problems.
Like what?
Well, for example, pelvic inflammatory disease, or PID, that can cause infertility, and chronic pain.
Wow.
And then some STIs can increase your risk of certain cancers.
Like which ones?
Well, HPV, for example, is linked to cervical cancer.
Right.
And then, of course, some STIs like HIV can be life-threatening if left untreated.
Yeah, that's serious stuff.
Absolutely.
Okay, so we've talked about the different types.
Right.
And the complications. Who's at risk for these infections?
Well, anyone who's sexually active can get an STI,
Right.
but there are definitely certain factors that can increase your risk.
Okay, so like what are we talking about?
Well, for example, having multiple sexual partners,
Okay.
that definitely increases your chances of exposure.
Makes sense.
And then engaging in unprotected sex, that's a big one.
So not using condoms.
Exactly. Condoms are super effective at reducing the risk of transmission, but you got to use them correctly and consistently.
Every time.
Every single time.
Okay, what else?
Early sexual activity can also be a risk factor.
Okay, and then our sources also mentioned substance abuse.
Right.
What's the connection there?
Well, when people are under the influence, they're more likely to make risky choices.
Okay.
Their judgment's impaired. They might not think clearly about using protection.
So they're more likely to
Yes.
engage in risky sexual behavior.
Yeah, they might not assess their partner's sexual history as carefully.
Okay, so it's all about making informed choices.
Yes.
But when you're
Yeah,
under the influence, that's harder to do.
absolutely.
Okay, so let's talk about prevention.
Okay.
Because the good news is there are things we can do to protect ourselves.
Yes, absolutely.
So what are the most effective prevention methods?
Well, abstinence is the only 100% effective way to prevent STIs.
Yeah, okay. But for people who are sexually active, what can they do?
Condoms, condoms, condoms.
Okay, so consistent
Yes.
and correct condom use.
Exactly.
Okay.
Super important.
What else?
Regular testing. Knowing your status is key.
Right, if you don't know, you could be spreading it
Exactly.
without even realizing it.
And then vaccination. We have vaccines for HPV and hepatitis B.
Oh, that's right.
Yeah, these vaccines offer excellent protection against those specific viruses.
Okay, so if you can get vaccinated,
Get vaccinated.
do it.
Absolutely.
Okay, so let's say someone does get diagnosed with an STI.
Okay.
What happens then?
Well, the good news is that most STIs are treatable,
Okay,
especially if they're caught early.
so treatment depends on the type of infection.
Yes, exactly.
So for bacterial infections,
Antibiotics usually do the trick.
okay, and for viral infections.
We use antiviral medications. These help control the virus and reduce symptoms.
Okay, and parasitic infections.
We have antiparasitic drugs for those.
There's hope for a full recovery.
In most cases, yes. The key is to seek medical attention as soon as you notice any symptoms, or if you think you might have been exposed.
And I know we've said it a bunch of times.
Yeah.
But it's worth repeating. It's so important to complete the full course of treatment.
Yes. Even if your symptoms go away, don't stop taking your medication.
Right, because you could.
You could develop antibiotic resistance, or the infection could come back.
And that makes it
Exactly.
harder to treat in the future.
Exactly.
So before we wrap up,
Yeah.
any final thoughts for our listeners?
Well, I think the biggest takeaway here is that knowledge is power.
Right.
The more we understand about STIs, the better we can protect ourselves.
And the better we can protect others.
Absolutely.
So we encourage everyone to keep learning about this topic. Talk about it openly with your partners, with your healthcare providers.
And remember, your sexual health is part of your overall well-being.
So true. Well, that's all the time we have for today's deep dive. Thanks for joining us, and we'll see you next time.
See it.